Welcome to Respond to Violence, Impact of Mental Health. I'm your host, Brandis Friedman. This program will take a look at the impact of mental health and poverty on incarceration, how this has become a criminal and social justice crisis, and why some say Cook County Jail is now the nation's largest mental health institution. The United States has one of the world's highest prison populations. Approximately 2 million people are incarcerated, many with untreated mental health issues. No one understands this better than Sheriff Tom Dart. He believes Cook County, the second largest jail in America, is now the biggest mental health facility in the nation. Of the approximately 8,000 inmates, about 40% struggle with mental health or extreme poverty issues. The Center for Disease Control reports about 25% of all U.S. adults have a mental illness, and nearly 50% will develop at least one mental illness during their lifetime. It's not surprising that these statistics are showing up in the jail population. Through necessity, Sheriff Dart has become a leader on the issue, hiring Dr. Nneka Jones Tapia, a trained clinical psychologist, as the jail's executive director in an effort to get in front of this health and criminal justice crisis. Together, they've implemented innovative programs to address the mental health and poverty struggles of inmates. Both believe treatment can help reduce recidivism while getting them much-needed care. Their revolutionary and sometimes controversial approach is getting national attention, causing many to question the current practices of our nation's overcrowded prison system. And joining us to talk about the impact of mental health on Cook County and the criminal justice system are Tom Dart, Sheriff of Cook County, and Dr. Nneka Jones Tapia, the Executive Director of the Cook County Department of Corrections, Cook County Jail Warden, and a licensed clinical psychologist. Welcome to the program to both of you.
Thank you. Thanks for having us on.
Sheriff, my first question is going to be for you. This is obviously a very serious situation for Cook County. How did we get into this crisis?
You know, the one thing I found when we started working on this is that we're not unique in any stretch. Particularly once we started making these changes, we had jurisdictions from all around the country reaching out to us to see what we're doing and how we're doing it. And in doing that, it became clear that all around our country, the same thing is rolling out, which is, for whatever reason, our society, and we need to take responsibility for that, has decided that as opposed to treating mentally ill individuals as people with an illness, our society has decided to criminalize it. So everywhere you go, you'll see this behavior, because I kept thinking when we first started working on this that I just need to go to a jurisdiction that's doing it well and we'll just model it after that. And I come to find out that we not only are the best now, but around the country, still going on as I sit here now, some of the most abhorrent behavior you've ever seen were people who truly have an illness. And Brandis, I mean, you think about it, I always tell people, I go, if we're going to treat mentally ill people like criminals, why stop there? Let's go after the diabetics. You know, that's an illness, and let's just say as a society, we don't want to treat them anymore, so we're going to lock them up. Because literally, that is what we're doing when we decide not to treat people on the outside. Inevitably, we all know what's going to happen, and that is what's playing out. They're streaming into jails and prisons everywhere, to where right now, 49 of the 50 states, the largest mental health hospital is a jail or a prison. So it's not unique to us. It's going on everywhere, and it's something that 100 years from now, we are going to have people looking back on us and saying we were rotten people for what we treated people with an illness. Well,
and in that vein, obviously, the closure of mental health facilities around the state, around the city, that's had an impact on your population and the makeup of that population as well.
You know, honestly, God, Brandis, I've been doing this for a while now. I would like to think that collectively, as we get older, more experienced, whatever you want to call it, we would stop making mistakes that are easy, but also being much more logical. And if we were logical, we'd sit there before we would shut down any hospital or any clinic. We would have not just a discussion, we'd look at data, raw data, and say, listen, do we not need these facilities anymore because we don't have this type of population anymore? And if so, then I would say, okay, I'm all on board. But when they shut down the hospitals, and certainly when they shut down the clinics in the city of Chicago, they never contacted us. They never said, hey, have you guys had a big dip in your mental health population where we can start shutting things down? Is there a new way to treat people? They literally shut them down just to save money, which truly not only is inhumane, but it's pig-headed, because it's not as if all of a sudden the mentally ill now have gone on to a different place. No, they're just in a different place that's more expensive, more inefficient, No doctor on this planet would suggest someone with, say, bipolar disorder, I got a treatment plan. Let's throw them in a 4x8 concrete cell with somebody else who has a different illness, and let's just leave them in there for, I don't know, as long as we want, and then expect a good result, because when it's time for release, we're just going to throw them out in the street. But yet that's what's going on all around the country, and that's what we collectively have gone about changing. But it truly is. This is going to be a stain on our society for decades, 100 years from now.
When you realized that this was happening and that your jail was starting to fill up with people who had mental illnesses, what were some of the steps you took, first things you did?
Well, I didn't know Nneka yet at that point, so I wish I had had her around. So I was left with, as a history major, mind you, just literally dreaming this stuff up myself, where it wasn't terribly tricky from this standpoint. It was more along the lines of, if I had a loved one in this setting, what would I want? And so clearly at the beginning it was like, okay, well, first off, we don't want them in here. So let's try diversions at the front end. And we tried some things there that were not successful, not frankly because we were not doing what we needed to do, but the judiciary didn't buy into it. And so then once it was clear that no one was really interested in true diversion, then it was like, okay, why they're here, let's treat them as they should be. Let's treat them as a patient, and treat them not only just with medication, which we received from Cermak Hospital, but also with different programming that would be helpful for someone that you're trying to get back on track and then prepared for going back to the community. So we literally put this continuum together as if you were a patient in a hospital, working with you, working with your family, discharge planning you. Actually, there's a point now where we drive people home and we give them plans on where they can go for their medication, and like just this whole different mindset. So we were doing different elements of that, and then when Nneka came on board, which was just such a godsend for us, we were able to ratchet it up even further to where we have these different programs which are truly national models of how to deal with people in these type of settings. And they're just incredibly impactful, powerful, and the results are really neat. The results are, we study them, we brought in University of Chicago, Loyola, DePaul to work with us on these, and the numbers are just startling. When you do what we're doing now, you see the recidivism rate dropping dramatically for this population. You do see it though picking back up when they're no longer really connected to us anymore, and then they're left to the system that's out in the community, which has been eviscerated. So then you go right back to where we've been.
Now, considering that street gangs account for about 80% of shootings, what impact is filling the jails with, non-violent, mentally ill inmates or detainees? What impact does that have on reducing violence?
It really, it obviously confuses the message, but with a lot of the issues that we've been experiencing, particularly in the city of Chicago, I think that it's naive to begin to just sit there and talk about just arrest rates and things like that. I've often suggested to people, if you think about, solutions to the violence in the city, it has to come about through this buy-in from the community. Well, buy-in comes when you've developed a trusting relationship where you actually believe the community, law enforcement, we're in this together. And I've suggested to people, well, how can you get this buy-in if you have been incarcerating relatives of people in these communities for all the wrong reasons, whether it's because they're mentally ill or because they're poor. And it's literally what's happening. I used to be a prosecutor, so I know the system pretty well. And I can tell you that when you start putting people in a jail setting that do not belong there under anyone's analysis, then it can't help but poison the well throughout the communities that are being impacted here. And so it has this huge ripple effect, but then you get into the more, logistical part of it. You're taking up bed space that you should use for violent people with people who don't need to be there. And, we do some marvelous things. We have some great programs, just incredibly enlightened programming that we have there. But nonetheless, you shouldn't have anybody in there for 1 second unless you absolutely have to do that for the safety of the community. And that's just how it is. And that's not how our system is played out.
How would you compare your stance on the smart on crime philosophy to the tough on crime philosophy?
You know what, at this point in time, once again, I get so fed up with this stuff that you're just left with scratching your head. We've run out the tough on crime thing, okay? Tough on crime works if you're talking about murderers and people who are shooting people, assaulting people. That's fine. You can play around with that. But when you're now taking that model and dumping it over all of these different offenses, it does not work. It has not worked. What needs to be done is to actually use this thing called data. It's a newsflash for most people. But the point I've tried to make to people is that you think about any thoughtful society anywhere in the history of the world, the most impactful thing that society can do to its citizens would be, I would suggest, execute them would be one. Right after that would be to incarcerate them. And then you can start talking about, all the other things that a government can do. When I became sheriff, my predecessor got the ball rolling, but we were run by a data system that was DOS-based. And you could imagine, I was lucky if I can tell you who was in the jail. Other jails and prisons all around the country, good luck finding out data. And the only reason I bring that up is, if this is such a significant thing, you would think you would have the best data, studied all the time, analyzed, looked at, is this penalty structure working for this population? What's the reason? Other than, frankly, institutions, advocacy groups, people in the criminal justice system never studied anything at all. They just kept incarcerating people, release them, see what happens, and whatever. It's not my job. My job is just to hold them. And so you have something where the system was not being used properly. So when people are talking tough on crime, I'd always say, okay, what's your data? Oh, we don't have any. Oh, that's brilliant. I wouldn't let my 8-year-old get away with that answer. And that's what you're saying. But the stuff that we're doing, we've tied all this data to it so that we literally can go to people and say, listen, when we did this, this was the result that we got. This result is both humane, but it is also ridiculously cost effective. So the criminal justice system needs to be looked at, under that lens all throughout the country, that collectively as a society, we never really cared. And if we did, we would have been studying this thing to death. We would have been tweaking it and looking at it. Instead, we came up with these sort of like catchphrases, tough on crime, soft on crime, nothing else attached to them. But the true tough on crime stuff, when it has been placed over all these offenses where there's no connection to the penalty and what you're trying to get at, it was an abysmal failure.
What role would you say poverty plays in your jail population?
Oh my God, I don't know how you get around that issue. When you have, like at our place, where you have, 200 people that if they had $500, they can get out of jail, and you sit there and say to yourself, okay, well clearly, if the bond was set at $5,000, you got to put up 10%. Clearly, there's a signal being sent here that it wasn't that serious, that we're not dealing with, Hannibal Lecter here. Then why are we putting up this sort of barrier that they have to put up money? And so there's just really absolutely no way to look at this. Then you can sit there and say that there are elements of the jail where the fact that they're in there is only a function of their poverty. And then when you look at some of the crimes that have brought people in there, where you're looking at survival crimes, some of the property crimes and things like that, clearly the strategies don't meet what the actual crime itself was. And so they have this complete disconnect. But the poverty issue, as far as I'm concerned, is really at the forefront when you're looking at who's being held on the minor to medium type offenses, where you find this incredible disparity. People with money, they get out. People with no money, they don't get out. Identical crimes, identical backgrounds. Well, if that's the case, then let's at least be honest and say, listen, and by the way, part of the system is if you are poor, you get treated one way. If you're not, you get treated another way. But let's not hide behind this other thing, as if there was this somehow very, very well thought out system that gave a dollar figure to this that has some relevance to something else. It's not there.
What impact have the recent bail reforms had on this whole situation?
You know what, it's funny. If you'd asked me this probably about like 3 months ago, I would have said, incremental changes. We've had, from my office, I've had a bill in Springfield now for, I think, 2 years that really someone calls for blowing up the whole bail system and getting rid of the money element altogether. And that has been going nowhere. And so we went down there 3-4 years ago and did some more incremental changes because we didn't think that the General Assembly would have the taste for major changes while we ran this bigger bill. And so incremental changes. Then about 3 months ago, something in that range, the judiciary, and I'm not going to get into their motive, good or bad, I don't know what it is, but they came up with a new method of going at bail, which not only is supposed to, and I believe it is, giving more emphasis to the different factors that you would want them to, like the severity of the crime and individual's background, but specifically giving thought to what that individual's financial background's like. And so there's supposed to be a connection to really what can you pay. Not just, this amount and they could never make it, but the connection there. And as a result of that, the last, I'd say month and a half since this change went in effect, we've definitely seen our population dropping substantially. And we had never seen that before. And so, once again, if you had asked me 6 months ago, I'd say we're spinning our wheels. We do a lot of talking, a lot of pointless meetings, nothing getting done. The last month and a half is the first time I can honestly tell you I've seen legitimate structural change, and it's been exciting to see that.
Dr. Tapia, let's bring you in a little bit. I know the county jail numbers, the inmate numbers have decreased recently, as the sheriff just mentioned. Of course, do you attribute this to anything more than the bail reforms the sheriff was just discussing?
Well, you know, from the data that our justice partners have talked about, you know, arrest rates are down in the city of Chicago. That has had an impact. But despite the decrease in our overall population, our number of those with mental illness and substance use disorders are not going down.
So let's talk a little bit more about those numbers to go over the urgency of the issue. So among the 8.9 million mentally ill adults with substance abuse disorder, 44% received substance use treatment. Only 13.5% received both mental health and substance abuse treatment. 37.6% did not receive any treatment. Now, those are obviously some astounding numbers. Tell us a bit, if you would, about some of the mental health programming and treatment that you provide.
So, you know, we have an on-site mental health and medical provider that they provide most of the treatment for those that have more serious mental illness. The treatment that the sheriff and I have instituted focuses more on those that are deemed higher functioning and more wellness programs, because we know that with the rates of violence in the city of Chicago, we have a number of people that are coming into our custody with symptoms of trauma. And so we've really been focused more on setting people up so that they're more successful when they leave our custody. And the sheriff is the one who innovated this idea of just because they leave our custody doesn't mean that we have to stop helping them. And so the most important thing that we've instituted is case management, even post-release. We have case managers that will reach out to individuals that have left our custody, and they maintain contact. We have alumni programs where people voluntarily come back to the jail for ongoing treatment. And then most recently, we went to the city of Chicago, who, you know, they closed the 6 mental health clinics. Well, we reopened one of those mental health clinics based on the data that we found, finding that many of our individuals on the mental health caseload in our jail were coming from the southern and western parts of the city of Chicago, where we closed the mental health clinics. And so we reopened one on the west side of Chicago, and it's been thriving.
That's a lot to ask of a jail to get people to come back for treatment.
Yes, but you know, we can't, you know, continue to wait on other people to fill the void. You know, I learned this from the sheriff, in that we're action oriented. We see a problem and we're more than capable of managing the problem and showing other people what works and what's effective. And so we're really trying to be the model, not just for other correctional institutions, but for the city of Chicago, the county of Cook, the state, and the nation at large. And we just care. And when you put that heart into your work, you see a problem and you can't just let it continue to fester. And so while we do run a jail, we also know that our customers are the people in the community.
I'm sure you have a budget for all of that work, of course. How would you describe the cost to taxpayers when our jails and our prisons become society's mental health institutions?
Well, you know, I can tell you that it triples, quadruples the cost. You know, when we look at primary prevention and early intervention, cost is much cheaper than adding the $168 per day it takes to house someone in the jail, on top of providing the mental health and medical care, which again can triple and quadruple that number. Then we know that we're not being fiscally responsible.
Well, and you know, it's funny because Nneka and I've talked about this as well. I mean, if you literally had set out to say for some parlor game, dream up the most inefficient, most expensive system, we nailed it. You're like, you got to be kidding me. Because when you think about it, the treatment model itself is not one that anybody would suggest is an appropriate one for someone with a mental illness. But then the tradition always has been, and that's one of the things we always sort of had to push back against, was because people would always suggest that we're sort of out of our lane a little bit and we shouldn't be doing this. And I was like, no. We're supposed to be doing things that are impactful to the community, to try to make the community better and also to try to decrease crime, okay? And so as a result of that, we can't just constantly do just the bare minimum, which has been done throughout this country forever, where the sheriff always looked at it, my job is I get a court order saying to hold this person, I hold them, then I get a court order to release them, I release him. What he did before, what he does when he leaves, really not my concern. And so we said, well, no, that's really being dumb, and let's at least shoot for not being stupid here. And so when we looked at it, I mean, there was no way to argue against the notion that what we were doing, collectively saving lots of money, and it was real money that we can actually put our finger on. Not just sort of this nebulous thing that by going into our program, you're now going to head off to, you know, greater things all the time. It was like, no. We know we've avoided these following costs. These costs are very expensive, and now we've reduced those. And so it's something where budgetarily, all the things we've done, we've never gone to the county board, for example, and said, listen, I need my budget increase for this amount or that amount to do X, Y, and Z. What we did is we found ways to repurpose positions in our office. We took ways to change sort of themes of different things, because we used to run a boot camp, which boot camps were done all throughout the country, all through the 80s. They were sort of the rage. And we found that is a method of dealing with crime. They weren't very effective. Just the numbers didn't bear it out. They were very expensive to operate, and the recidivism rate against that group as opposed to a cohort that didn't go through there, you just didn't have that type of deviation that made sense. And so we changed the purpose of that to another thing that's really pretty cool that we're doing, where we teach people, detainees, how to demolish buildings, operate heavy machinery, and then we go into places like particularly the south suburbs and we tear down buildings. We've teared down, I think, about 200 now that have been abandoned, dilapidated for decades. So we do that, but what we did was, the more important part of that is we took the location where the boot camp was, which is by the jail, right about a block away, and it's this somewhat bucolic setting of Quonset huts and gardens. And that's where we do most of our work with the mentally ill, because it was the same notion that they don't belong in a correctional setting, so let's put them in a non-correctional setting. And by doing that, we will make their entry into the community more seamless, and we will change their mindset, and we'll work with them to stabilize them. All of this not only being humane, but incredibly more thoughtful and, dollars-wise, much more effective.
And before we move on, some correctional facilities, they've refused to accept people who are displaying mental health issues. What are your thoughts on that?
The one thing that I know that we've always said is we don't have the option of saying no to anybody. The reality of it is we have all these folks that are dropped off at our place, and saying no was never an option, and we wouldn't want to walk away from that either, because we wouldn't want to try to shuffle this off and say, no, we just have this very narrow interpretation of what we're supposed to do. It's like, no, we're trying to affect change and help things here. But it's one of the things where I think it's lent itself to where people more freely will eviscerate these programs. They say, you know, oh, that goofy sheriff, he'll handle that one then, you know, he'll just take care of that. And so we've struggled with that when we talk about this, because our programming has gotten to be so sophisticated and so good that are we somewhat enabling people on the outside to say, well, we just don't really need to do that. They'll take care of that, and they're doing that. And so it's a little bit of a struggle we have. It's not going to lead us to walk away from people, but it is sort of strange, because there are some folks that find ways to really, really narrow the scope of their job, whereas, as Nneka was referencing earlier, we always sort of try to think of ways to expand it without going beyond our budget, but expand it so that we can impact more people.
So for those struggling with mental illness, self-medication can lead to minor drug offenses. Now, this can get you as much as 300 days in jail while awaiting a court date from an overburdened criminal justice system. And once you're in the judicial system, it can be very difficult to get out. In an effort to reduce recidivism, Sheriff Dart and his staff are trying new approaches to help inmates rebuild their lives.
You're in a place where you have an unlimited amount of time, where you're in a cell for about at least 12, 14 hours of the day, out in the day room. You have a lot of time on your hands. So it's not so much the question as, you know, how to handle the class in this environment. It's more, how can I get the most of this and make the most of my time while in here, so that when I leave a better person, a better writer, a more productive member of society.
My expectations was to gain more knowledge, to improve my writing skills, and to help me prepare for the future. To be honest, when I first heard of the program, I thought it'd probably be a little bit of experiment, but I had no idea it was gonna go this well. I had no idea. I've been in Cook County for 3 years, and I've seen like school wings and school decks, which are normally some of the worst decks in the compound. So that's what I really expected it to be, but I was totally wrong. Totally wrong.
So I feel like it's an educational environment, you know, one where I can just focus on writing and not have to worry about anything else, physical or otherwise.
They try to get us where we need to be at. They go the extra mile, they work with us, they answer our questions, and they don't lose any patience with us.
We go in not really knowing what to expect. When you come out, the finished product, life skills, growing as a group together.
The thing that stood out for me about the program is the people that were in charge of the program wanted to be here and wanted us to succeed.
We're in jail, so there's always walls, so to see somebody open up and find out the depths of their story, their soul, you realize you can't judge every book by its cover. You can't judge them by their cases. There's more to them than just jail.
Dr. Jones, what do you hope programs like that will accomplish?
You know, we hope to have a larger impact, not just on the individual, but on their families as well. One thing that is very inspiring with the programs that we initiate are the calls that we receive from the family members thanking us for the transformation that they've seen their incarcerated loved one go through. And we know the importance of family when, you know, you are locked away from the rest of society and your family doesn't have the capability to see you whenever they want to. And so just knowing that their loved one is not only being cared for appropriately, but thriving in a jail, I know that has a tremendous positive impact, again, on not just the inmate, but the family as well, which impacts the larger community.
But that non-traditional approach, sometimes it leads to the criticism that you all are being soft on inmates. Some of those gentlemen are in for very serious charges. How do you respond to that?
You know, the data that the sheriff spoke about earlier, there's truth in numbers. And so when we initiate programs, we look at a wealth of data points, one of them being incidents that occur in the jail. And for every program that we've initiated that we found to be effective, there's been a great reduction in incidents, which makes our staff jobs easier. And so when we show our staff those data points and when we get their investment, they recognize that, and that increases buy-in. And we are hoping that that will spread amongst our ranks.
I imagine it's probably also cheaper to provide treatment rather than at some point they are released and it costs us more.
Yes, yes. And you know, what we were seeing so often was that revolving door. You know, it was almost like clockwork having someone come back into the institution. And it's nothing more heartbreaking than seeing someone at their best when they're leaving to come back at their worst. And you would ask, you know, well, what's going on? What happened? You were doing so well. And, you know, more times than not, we would hear the individual say, well, I couldn't get in to get my medication, or, you know, I couldn't get a job. And so listening to those stories, again, that's what inspired us to put action behind our work. And so not only are we providing mental health treatment, but we also have vocational skills programming as well to try to increase the likelihood of success when people leave our custody.
And you know, one of the things too, Brandis, the point that I try to make when we talk about this, it wasn't just because Nneka and I had free hours, which we absolutely don't. We work like 11, 12 hours every day. And so the thinking, and once again, this gets to this point I've been trying to make about society-wise, you know, our culture, how misunderstood the criminal justice system is. And as a result of that, it leads to things where the wrong people are held for too long, and people are coming right back in. Most people think that, okay, someone commits a crime, they get arrested, they go to the jail, they sit in jail, wait for the trial, they go to prison, they get some programming, then off to the community. That hasn't been the model for I don't know how long, but that's what most people think. So as a result of it, when people are thinking of intervening to try to break cycles, they're all sitting there saying, we got to go to the prison systems to put programs in there. We have 80% of the people who enter our jail go straight from the jail back to the community. We have more than 1,000 people a year, because our judicial system at times moves rather slowly. They spend their entire sentence with us. So they serve their whole sentence with us because it took so long. But then the other point too, I always try to make to people, Last year, the entire prison system, all of the prisons, released about 33,000 people from the prison back to the community. One jail, released over 40,000 people from the jail back to the community. So when people are sitting there saying, okay, well, these communities are having these issues with violence, and like, what can we do to try to help it and fix it? Well, what happens when you have the #1 funnel of dysfunction for those communities? Because most of the people coming to our jail and leaving it go back to the same zip codes where the violence is going on. When you have the funnel for it, doing nothing for programming, because they didn't get the memo. They think that, well, we just hold people and then off to prison. We got the memo on day one. It was like, no, that's a fantasy. So we are the hub. We have to do the programming to try to make people better off, so that when we go to the community, they're helpful. They have opportunities for jobs. They have opportunities to be a better dad, someone who can actually help amongst the community, as opposed to someone who's walked out with no skills other than what they might have picked up from somebody else who's in on a different crime, and then they're floundering. And then we set up all these other hurdles, making sure that, that people have all these collateral consequences where they have these records and they can't get hired because they have a record here and this and the other stuff, and you can't expunge this. We have decided that we were going to take it upon ourselves. So we're actually going to try to do beneficial things for communities and not just sit back, frankly, and do the minimum, which is done throughout this country, and then just, all shrug our shoulders, collect our pensions, and just move on to something else. It takes a lot more time. We work incredibly long hours, but we find that we're like literally right at the point of trying to help communities, because we're actually tackling the real problems. And a lot of people too, Brandis, they shy away from getting involved with programming in jail because the population is inherently transient. We never know when someone's going to plead guilty. We never know. We have 18% of the cases of people who come into our custody, their cases get dropped. So we never know when those events are going to occur. So people say, well, how can we program? We never know we're going to be there. And I said, well, we have to program, because if not, we are just part of the problem here. And so that's when we come up with these programs. They have the dual function of both trying to make people better, whether it's mentally better or giving them job skills when they leave, or it's trying to work with people who we know are going to go to the prison system, but to get them in a different mindset that helps them themselves, but absolutely statistically shows they are better detainees. They don't hurt other detainees. They don't hurt our staff. And it just makes for a better environment where you can do more things then.
Are you all seeing a reduction in recidivism, either locally or nationally, when mental health issues are being actively treated, or do we need more data on that?
Probably both, because we decided that thoughtful people don't rush out after one day and say, we had a dip today. It's like, oh my God, please, will you grow up? So we knew that the different things we had to be studied over a few years. And so we're doing that with some outside entities doing that. But at the same time, we figured, well, let's not wait, because frankly, we could be going in the wrong direction. And what, are we going to wait 5 years to figure that out? So in the meantime, we've done just somewhat snapshots of different populations. And so we're filled with remarkable anecdotes, which I've always told people, I refuse to fall into the pot with the rest of the political world where I can come up with a great anecdote. Forget all the numbers and the data. I'll just give you a great story. We have a lot of those. But in addition to that, the snapshot studies we've done have shown that when you're basically 30 days to 60 days, I think, out from our treatment, the numbers are staggering how good they are. Whereas traditionally this population would be coming back in contact. Very good. Once we push out beyond that, though, we see our numbers then starting to normalize in the bad direction. And that is because that's when it gets trickier for these people to access all the things Nneka mentioned. And I'm not saying that we're not to blame then, but it's just very tricky because we no longer have custody of the person. They don't have to do anything we want. It's just these relationships we've built with them makes them want to continue to work with us.
And Dr. Jones, you mentioned this earlier, some of the after-release treatment, but I imagine you all also work with partners in the community to continue some of that treatment so that recidivism doesn't happen once they get further down the road from release.
Yes, we not only work with partners in the community for those that have been released from custody, but we couldn't do a lot of the work that we do were it not for the partnerships of people that come into the jail and provide services. And so we work with hundreds of agencies that come in and provide services, from yoga classes to drumming, which you saw on the screen, to photography classes, to hardcore mental health programming. And so that benefits us, and that's how we've been able to initiate a lot of these programs without expanding the budget. And so, and it's helpful for the individual to put a face to the program while they're in custody, because then that increases the likelihood that they're going to continue to engage with that same treatment provider when they're in the community. And not only did we do that, the movement of people, community agencies while individuals are in custody and out of custody, but at the point of release, we have a community partner that engages with those that are on the mental health caseload just before they leave custody. As a reminder, hey, we enrolled you in the Affordable Care Act. This is how you pick up your expanded Medicaid coverage information. You have an appointment with this provider in the community on this date. If you don't have transportation, we have a wonderful family that the sheriff worked with that donated a van to the sheriff's office. And so we have the capability of picking someone up from their home or the residential treatment center, for example, where they may live, and driving them to their appointment in the community, because we know transportation is also an obstacle. And so those are the things, again, that we've been able to do based off of our relationships and their strong relationships with not only community providers, but family members that have seen and are a testament to the good work that we're doing.
What is it about a mental health crisis that can actually lead someone to commit an act of violence?
I definitely want to be clear that I do not believe that mental illness leads to violence, but I do believe that untreated mental illness has the potential to lead to violence. And what we see more times than not, when someone is unable to get treatment or unwilling to go to treatment, and a lot of families struggle with that, then it can lead to increased violence. And, I would be remiss if I didn't say that, when we have individuals coming into the jail and they're in for, let's say, a low-level charge, and they are suffering from a mental illness, and they encounter individuals that have more violent behaviors, then they learn that. And so we're doing ourselves a disservice by having those with mental illness come into a jail when they don't need to, when they really need to be in a treatment setting. So despite all of the great work that we're doing in the jail, we have to look at what we're doing as an overall community to make this problem worse. And that's why I think so many, not to say anything negative about the media, but the image that I think we portray in the media of someone with mental illness is someone who's violent, and that is not what we see. When we have someone coming into our custody that is suffering with mental illness and that has gone untreated, they're really suffering and they're at their worst. And that is an opportunity for us to rebuild them and to let them know that we're not only here for them while they're in our custody, but we're here for them even when they're released as well.
In the majority of the people that we have come into our custody with a diagnosed mental illness, they're in on nonviolent offenses that are the ones that you would expect. They're in on criminal trespass to property. And what does that mean in English? That means they were trying to find a place to sleep. So they were on a bus and they wouldn't get off, or they were at O'Hare Airport and they wouldn't leave. Theft. They're stealing something to eat, stealing something because they just steal it, not really knowing why they stole it. We get that a lot. Those are the majority of them come in. And even, it just shows you, once again, as a person who still uses a flip phone, okay, which I've had now for 12 years, that's what the county
Which
gave
he proudly admits to.
I absolutely do. I love it. That's what the county gave me 12 years ago, and I've stuck with it. It works. But so, people would think, oh, you're not Mr. Data Wizard or like that. No, I meant me not, but I understand what it connotes about our society. When you're not looking at data, it shows you really don't care about something. When you look at the mentally ill, for example, what you see gets sort of really woven into it is when you talk about the violence issue, there's no real distinction made. And what I mean by that, I'm not saying there's good violence, bad violence, but there's different types of violence. So frequently when you look at someone with a diagnosed mental illness, the crime of violence is a domestic violence, usually against a loved one who is trying to say, you have to take your medication, you can't go out, you can't do this, and they take a swing at them. And I'm not trying to obviously condone that, but I'm saying that's million miles away from the notion that gets painted too often about the mentally ill people are the ones committing all these horrible acts of shooting violence and the rest of it. It's like, no, the majority of people, A, aren't committing violent offenses. They're in on these crimes of survival. The ones in on violence, they're usually either domestic because of the scenario I talked about, or it's resisting arrest, which is listed as a crime of violence. And what does that mean? A police officer who, by and large, were not trained to do this, comes across someone on the street because all the shelters don't accept them, they've all been shut down, all the treatment's gone. And when they come across them, they push them, they resist, they don't want to get handcuffed, and that goes down as a crime of violence. And so even within the data, it doesn't even speak to the realities here.
Well, and currently the Chicago Police Department is implementing Crisis Intervention Training, or CIT. It's to help officers recognize and engage mental illness. CIT is a national movement that many will feel gives law enforcement officials an important tool to assist citizens in crisis.
The mayor recently announced that all new recruits will get de-escalation training. And then on a voluntary basis, veteran officers can get what's called crisis intervention training. And the department now is standing up a unit, not unlike a SWAT team, if you will, that is trained and focused on intervening specifically in crisis intervention training. One of the questions that I think we're confronting in this time is really, what is the job of a police officer? And focusing on the mental health question, whether or not officers should have to deal with these issues. The practical reality is, should or not, they are. People in our community are suffering from mental health crises. They need the assistance, and sometimes they need the assistance that police officers can provide. So providing those police officers with the kind of training that they need is critically important. I think we have a unique opportunity in this time when there's a lot of focus on reform and accountability to really ask that fundamental question as a community and have a conversation around what our expectations are. While I believe that police officers need to be empathetic, they need to have the information to recognize different circumstances that they're going to confront on the street and the tools to be able to handle them, they are not mental health counselors. So we as a society need to make sure that we're making the right investments in the right ways so that police officers can do their job, which is specific but also limited. Police officers are the face of the government. They are the primary government actor that comes when called. So it is incumbent upon police officers to make sure that they have a whole range of tools in their toolkit to be able to deal with the kind of crises, calls, interventions that they are going to experience on a day-to-day basis, one of which clearly is mental health crises. That's why the training needs to be mandatory so that officers have a level of sensitivity around these issues and have the tools that they need to be able to handle them if they're confronted with them. In order to redirect citizens away from incarceration into treatment, there's a number of different things that have to happen. First and foremost, we need to make sure that we have sufficient community-based resources so that folks can get the kind of care that they need. That unfortunately hasn't been as big of a priority as it should be. We know that a number of mental health clinics were closed, but I think what the city ought to be focused on is leveraging its scarce resources to interact with private resources to make sure that we've got a seamless network of care so that folks don't have to travel great distances to be able to get treatment that they can afford. Many people have mental health challenges, and that has nothing to be ashamed of. Destigmatizing mental health should be a top priority for all of us. You need to be able to feel comfortable sharing with the 911 officer, for example, that the reason for your call is because somebody is experiencing a mental health crisis. That's deeply important because 911 operators take down the information, they give it to a dispatcher. The dispatcher then, based on the nature of the call, will assign particular officers to handle that call. So what this means is we need holistically to be working to get folks comfortable with recognizing that people are going to have mental health challenges. It's not a stigma, it's not something to be afraid of, but we still have more work to do on that.
Dr. Jones, can you tell us about the importance of this kind of training?
You know, it not only provides information to the staff, and you know, that of course will elicit a certain empathy that may not have been there otherwise, but it's also very reassuring to the staff member that they're being equipped with tools so that they can effectively engage with someone that they may not have been trained historically to engage with. And so it makes them more confident in their job. And what we hear more times than not from our staff that go through the crisis intervention training and our advanced mental health training is that they really feel like we've created a platform for them, a foundation by which they can identify someone with mental illness and can effectively engage. And we really pride ourselves on that officer-inmate relationship and trying to make sure that instead of having, what some may say historically has been friction between the correctional officer and the inmate, it's more of role modeling. And our staff are there to role model appropriate behaviors for inmates, those with mental illness and those without.
That's why one of the things, to be honest with you, we were very proud of is that we already have trained all our people. And so Chicago is going through it now. We did it years ago. And it was because of what Nneka said. It was, if we're going to be forced to be the largest mental health hospital, if we're going to be forced to, with my police department that I have as well, to be the front line here, we're going to give people tools. So all of our correctional staff, not just people in the mental health units, all of them have the advanced mental health training. All of my police officers on the street have CIT training, and we've had it for years. Is because this is the reality. This isn't something, we wish it was otherwise, but this is the reality. We have to do it. And so a lot of departments are just coming up to speed now on it, and I'm glad they're getting there. We saw it, and frankly, I mean, it's the truth. We saw it a long time ago, so we just did it.
Do you think this kind of training can help redirect people who are mentally ill towards treatment instead of incarceration?
I read all of our reports. So I have in addition to running the jail and all the rest of the stuff, I have a police department that used to be primarily in the suburbs, but now because of the issues in the city, we're in the city probably more so. I read all the reports of all the arrests and the like that we have. I can't tell you how many reports I read where our officers have intervened on a mental health related case and they go right to the hospital almost all the time. Whereas traditionally that would have been an arrest, that would have been a very confrontational type of setting. It's the opposite. We literally are putting them in the car and we're taking them to the hospital and leaving them there. We're not coming back to arrest you later or charge you later. We're just, you have an issue and that's how you go. So I know factually it has been going on in our office and it's had tremendous results.
How important is the support from the family and from the community to the success of returning citizens in an effort to reduce their chances of going back to jail?
It's invaluable. And so when, like I said before, when the individual is incarcerated, they have historically been cut off from the family unit, and we've made it a priority to keep the family engaged. So years ago, even before I joined the sheriff's office, he initiated a mental health care line so that family members could call the jail and let us know if their loved one had any symptoms of mental illness, medical illnesses that we needed to be aware of that maybe their loved one wouldn't tell us. And if something happened in the family and the individual in our custody may need added support. And so we can really, dedicate the necessary resources to that person based off of our connection with the family as well as theirs. And through those phone calls, we've been able to get the family to better understand what we're providing while the individual is in our care, so then they can help the person continue that treatment when they're released. We have a wonderful discharge unit that allows the inmate, the returning citizen, to call their family before they leave our custody, and our correctional staff will even drive them to their loved one and do a warm handoff so that, again, the loved one is comfortable as well as the returning citizen. And those are some of the little things that really amount to, the maintaining that family connection. We have family support groups in the jail so that, again, it adds a level of comfort, not only for the individual in our custody, but for the family member. And again, we know the importance of maintaining the familial contact and contact with the community as a whole.
And think about it too, is that being thoughtful? Yeah, and I would hope that's what we're striving for. But beyond that, if you're looking at recidivism again, the tradition all around the country was you got an order to release somebody. So the fact that they're acutely mentally ill, it's, in the middle of February, it's 11 o'clock at night, you got to release them, and if you don't, you're actually going to have liability issues. So off they went out into the street in a snowstorm. That was life, and that's what you were supposed to do. Now, is that an extreme case? I guess, but that would happen. That would play out all the time, actually. The reality of it is, though, if you're thinking of trying to initiate someone and get them back into their community in a thoughtful way, will that not have the effect of decreasing crime? How could it not? Because otherwise, you're discharging someone to the street with basically whatever they had when they came in, and now it's like fend for yourself, figure out how to get home, and if you can't get there, you work it out. That's going to lend itself to all sorts of horrible things. And so being thoughtful actually is really being smart. It's also reducing crime, and all this stuff actually works together. But I think sometimes in the criminal justice system, you're sort of taught that you have to be really tough. Now, I've often said, it's like, yeah, there's some people you should be tough with, some horrible people we have in our custody. Yes, all right, I understand that. But you treat people thoughtfully, with respect, and you treat people with a plan. But that has not always been the case, and that's where we've had these problems.
Now, GSU students and faculty from programs such as criminal justice, social work, and counseling are in our audience, and they submitted some questions for you all, for our guests. The first question, we'll get to as many of them as we can, of course, but Sheriff Dart, this one's for you. Considering your approach to addressing mental health issues at Cook County Jail and knowing the culture and resistance of some Cook County Jail officers who may see this as a soft approach, what methods are you using to change the culture of your correctional officers?
A part of it, I'd like to think we weren't naive. We realized it was a cultural shift, and many of the people that work there have been there for 20, 30 years, and so there was a method of operating that had just been in all cultures throughout corrections everywhere. So we sort of knew that there was going to be a little bit of, I'm not saying necessarily pushback, but a lot of people that were like concerned, we're going in a different direction here. So we've tried a lot of just the training and talking to people, but as Nneka, she referenced earlier, one of the things that I was adamant about is like we have to get out the data showing that by doing this in a much more thoughtful way, the incidence against staff has dropped incredibly. I mean, when I first became sheriff, the jail, it was no different than most jails throughout the country, where you have a lot of violence that would go on within a jail setting because you have all these different gangs, and the gangs have atomized, and it makes it even more difficult. We've had, throughout the country, there's been decreases in populations. That's allowed us to operate a little bit differently with a little bit more freedom and different things. But by being able to program and put some of these different types of approaches in place, we've been able to see even greater decreases in violence within the correctional setting, and we have all the data to support it. So a lot of it was just getting our message out to people saying, listen, this is effective. It actually makes your life easier. It's more thoughtful. It works for everybody. Do we still have some resistance? We always will. But that's, when you have a place as big as ours, we're the second or third largest jail in the country. And that's even hard to nail down anymore because our numbers have been plummeting, but elsewhere they are too. So, and it was never something I was shooting for. I want to be number one. No, that's quite the opposite.
Now, about 75% of your detainees are African American, and the DOJ has reported that about 1 in 3 African American males and 1 in 6 Latino males have a chance of going to jail or prison. What can Cook County and the state of Illinois do to address wrongful mass incarceration?
Well, I think we've taken the lead on this issue, truly, just objectively, by really going after the misuse of the criminal justice system. So in our policing side, we've put much more of an emphasis than ever before on true community policing. I mean, some people say they have it and they really don't have it. We actually have it, and we're doing it in the city of Chicago, and we're having some great results. So by doing that, you have less people that you're getting arrested. I also let people know who worked for me that, when it came to marijuana-related things, I had no interest in arresting people. And then thankfully, we've changed that to where it's a ticketed thing. But to get people to understand that we have some priorities, and our priorities are violence. The other issues are not the ones that are going to be driving us as far as on the arrest side of it. But then in the other part, I'll be honest with you, so much of what we've been working on has been attempting to get at that by having true bail reform, so that the only people in there are people who need to be in there. The people who are mentally ill aren't in these settings at all. But then really trying to look at this thing by saying, okay, what is it that is the common thread here? Well, there's no skill sets for a lot of these folks. So they've been let down either by their educational system, they've let themselves down. You have all these different factors in there. So we work a lot on programming so that we have people who do come into custody, we make them better than when they came in. And so there's this thoughtful type of plan to get people on their feet when they leave so that they don't, come back in. But then, I'll be honest with you, going after these other aspects of it that have had the tendency to bring people in, and disproportionately, absolutely, people of color, fixing the warrant system. It's something that I've been working on for about 2 years with very little luck, to be honest with you. Right now in Cook County alone, just under us, we have over 40,000 warrants for people. Most of them are for minor probation violations, but that warrant's no different than another one. If you get pulled over for a broken taillight, you're going in custody and you're going to spend time in jail. That shouldn't be the case. If we're talking about traffic-related cases, my God, we can't come up with a more thoughtful system that you missed a traffic case and we're going to keep you sitting in jail for a week to what? To what end? And so we've been really pushing that as something that really is at the crux of trying to reestablish faith in the community, that we care by fixing something that is illogical, makes no sense. And so we've really been working on a lot of these issues that people sometimes call collateral, by working at warrants that are floating out there for people, working at expungement, to sit there and say, let's have an expungement system that actually makes sense, because the one we have does not. And so for the last 3 years, we've really pushed the envelope on that, where we got changes in Springfield. Before, we got this change where before you used to have to pay $120 to get expunged from your record a case that was dropped or you were found not guilty. And I had to fight with Springfield over this. And they said, well, we're going to lose a lot of revenue. I said, you are not listening to me. They didn't do it. Well, we're going to lose revenue. I was like, oh my God, my 8-year-old gives me much better responses than this. I go, they did not do it. We shouldn't charge them $120 to remove something they didn't do from their record. And so those type of things are spread all over. And so from us, we're looking at this from literally 20 different directions to how we can make this so that we aren't embarrassed by these numbers, because these numbers are atrocious.
I think we are running low on time, so I unfortunately have a lot more student questions that I was hoping to get to. But I do want to mention a little bit of important information. If you do have a loved one with mental health issues who has been incarcerated in Cook County, or for a list of resources available to returning citizens, you can call the Cook County Services number that's listed below. It is 773-674-CARE. That's 773-674-CARE. Now, as I mentioned, there are many questions remaining, and this is an issue that we will revisit, but we are at the end of our program. I would like to thank our guest, Sheriff Tom Dart and Dr. Nneka Jones Tapia, for participating in this very important conversation. And for more information, you can visit the website about responding to violence. You can visit the website respondtoviolence.com. I'm Brandis Friedman, and on behalf of Governor State University, thank you for joining us.